We created the path by walking, and we didn't quite know how to get where we wanted to go, but we figured it out.
Do you remember when we got hospice started back in the mid-70s? Wasn't that an awesome time? Kind of grew out of a course at Gonzaga that we were involved in on Death's Mystery, Life's Meaning. I had heard Dr. Florence Wald from Yale University, the founder of hospice in the US, give a talk in Seattle, and that was my first knowledge about hospice. Brought it back, and you, counselor at Gonzaga Prep, an insurance broker, and a homemaker, the five of us decided we'd see if we couldn't bring to Spokane some alternate way of caring for people that were dying.
Right. And I was frustrated as a nurse in ICU and in long-term care. Remember that? And, and I knew we could do it better. I just knew it.
Well, the real challenge was it was a brand new concept that was both countercultural and revolutionary in American healthcare. I mean, folks really did say hospice back then. I mean, we were educating the medical community along with the broader Spokane community about this alternate way of caring for people who were terminally ill. The revolutionary message of hospice, when we were getting it started, was we are bringing caring for the person who is dying back into their own family with the necessary supports to assure their comfort, symptom management, and accompaniment as they walk through those final days that for many can be very scary, but with help, with caring support, can really be the fullness of living as a person dies.
Right. Like you had said before, that's how it used to be. People died in their homes, surrounded by their families. And then we moved into the hospitals and all, and people went to the hospital to die.
We believed dying is a simply delicate family affair. And our desire was to help families reconnect with something that for centuries had been the normal way of dying, caring for your own loved ones in your own home.
But by the time we were doing it, the families were like this: don't talk to my loved one about how sick they are because they don't know. And the patients say, don't talk to my family because they don't know, but nobody was talking to them, honestly. And it was a learning curve for all of us.
And it was really needed because you mentioned how families were keeping the news from the patient from the family, but the doctors too. As a nurse, I remember being told, you do not tell the patient that they have a disease that's probably going to end their life. And yet I had encounters with patients that would say they were, particularly one gentleman, he was angry because he said, I know I'm dying and nobody's talking to me about it. So there was this angst among all family, and patient. And I think everybody thought they were doing the right thing. But, we saw another side of that by studying hospice. It was hard, like we were just sort of trying to find our way as we went. And we'd come together regularly doing this planning. But each time it was like, okay, what next? We have to go out and learn more, do some research, connect with some more people, because we didn't have a map.
I remember specifically designing the programs to complement, not to redo or compete with stuff that was already available.
Right.
So we found out as much as possible what was available now and where are the gaps, and that's where we tried to do. It was amazing.
And there were challenges.
And we were young.
Yeah, we were really young.
We didn't know how to do it.
We had kids, we had all kinds of things. But there were challenges, Of course there were challenges. And one of the ones I remember, and it sort of tags on to what you said, Johnny, people didn't know what hospice was. So this effort to educate, particularly the physicians and the nurses and others, but also the community about what is hospice, and for a physician to get comfortable referring a patient. And then there was the concern about, well, how are we going to raise the money?
Yeah, because I had to work, remember, I worked nights.
I know.
I can't remember when I slept, but I know I did because I like to sleep. But I worked nights.
Yeah.
And then in the days, did the groundwork throughout the community, talking to people. Yeah.
Well, I
Till we got a
remember
grant.
because I remember, that was a couple of years later as we really had a board and everything. And the issue was we didn't know whether we were going to be able to make the salaries, pay the salaries. I think there were only 2, but we did not know how we were going to make payroll. And so we
I wasn't aware of that.
oh yeah. So I remember the conversation was, well, we're going to go out and we're going to approach people and see if we can raise the money. And if we can't, then maybe this was not meant to be.
Huh.
And that happened 2 or 3 different times. And first people we went to were the religious sisters in the community.
Is that right?
Uh-huh. And
Did they
we
give-
got enough money each time, so we kept saying, well, we're supposed to give out this.
Whoa, I didn't know.
Yeah, so there was no Medicare reimbursement or anything
No.
like that. Yeah.
From the outset, it was so important to us to create a community hospice for the community and of the community.
That's right.
We did not want to be aligned with any one or another of the existing healthcare groups,
Right.
but we wanted to collaborate with them all.
Right.
So we strove really hard to have a board of local citizens who would lead an stand-alone agency
Right.
that would be the community's agency, Hospice of Spokane. And that led us to some really tough financial times. But nevertheless, we did receive support from the United Way, for instance,
we did.
from the Agency on Aging, the Area
was
Agency
the
on
first
Aging.
one.
They helped us
You
a
remember
lot.
that?
Yeah.
Yeah.
And then the folks in the community, especially the ones who had received hospice services, began forming an awesome donor base.
Right, that's
So our legacy is a standalone community hospice for the people of Eastern Washington, supported by the communities in Eastern Washington.
It's just a perfect example of collaboration.
Yeah.
And that many heads
Right.
are a bit smarter than one.
Where there was no notion of ownership at all. It was
Right.
stewardship.
Right.
Our board were trustees of resources given by the community for the community.
Right.
And because of that, I think there are such deep roots into continuing that kind of service where everybody who has a need receives care. Reimbursement is not a concern. And the donors in Spokane, Eastern Washington, recognize there's no notion of this is theirs.
Right.
It is our
Ours,
community's
And
hospice.
that's the way it should be. Right.
It's just so gratifying to see where Hospice of Spokane is today because of the community and the support that it brings.
Right.